junior at UCLA studying, sorry, I'm a junior at UCLA studying psychology, and I'll pass it off to Eric.
Well, hi everyone. My name is Eric. I currently attend Glendale Community College. I'm in the process of transferring. Did apply to several schools. I'm currently a biology major at GCC. Looking forward to becoming a pharmacology major at USC or a molecular biology major at UCLA, but only time will tell. I'm also on the pre-pharmacy path. I also am the president of the pre-pharmacy club at Glendale Community College. And I'm also a pharmacy technician at CVS. So if you guys have any questions regarding the field and what it's like to be a technician, you can let me know. For now, I'm going to pass it on to Dr. Mirzaian, who's going to give a presentation on her background as well as the COVID vaccines.
Thank you guys for that introduction. I'm going to share my screen here and get into presentation mode. Can everyone see that? Okay, wonderful. So thank you very much for having me. I'm very excited to talk to you guys about a little bit about my path into pharmacy and also about COVID-19 vaccines. And I'm going to be addressing vaccine confidence, a little bit about vaccine hesitancy, and within that context, I'm hoping to address a lot of the questions, that burning questions that are on people's minds about the COVID-19 vaccine. So to start with, let me give you a little bit of background on myself. Is the sound coming in okay? Sorry, I'm not gonna, okay, good. So if you guys have any questions during this presentation, please feel free to stop me and ask. I would rather this kind of be a dialogue at certain points, just to make sure that I address everything you guys want to hear. Okay. Sorry, this is supposed to be animated and my logos came through before anything else. All right, so just to tell you a little bit about how I got started. I was introduced to the profession of pharmacy when I was in high school. I went to AGBU Manugyanda Mirzaian School in Canoga Park, California. Been raised in the San Fernando Valley my whole life. I still live there. So one of the advisory board members was a pharmacist who owned a couple of his own pharmacies. And I worked together with him a lot on developing just programs within our high school. And when I was graduating, I wrote like a cover letter and a resume. That was our AP English final project. And I just went ahead and mailed it to him, and he offered me a job in his pharmacy. So I went to undergrad at CSUN, and I was a biology major there. And then as I was in undergrad, I worked in the pharmacy. As I first started out as just a clerk, and I worked about 2-3 days a week, about 6 hours at a time. And because I accumulated so many practice hours, I was able to get my technician license from the California State Board of Pharmacy. So I worked there for four years, all throughout my undergrad. I had multiple jobs. I was a TA, calculus TA for my high school math teacher. I was a dance instructor at my old dance studio. So I did a lot of different things to keep me kind of balanced and continue to, keep me motivated in other arenas of my life as well, which I think was a really good thing, that I spent a lot of time in different little communities and sets of people. But I learned a lot in my pharmacy job at that time. So then I got into the USC School of Pharmacy, and I attended there. I started the PharmD program there, and it was a great experience. At that point, I quit my community-based pharmacy job, and I actually, my first day of school and orientation, I got a job at the USC Medical Plaza Pharmacy. So I started as an intern there for the entire time that I was in school. And I, I kind of made the decision that based on my experiences in a community-based setting, and also my experiences in school where I did a lot of hospital work, that I made the decision that I wanted to stay in my career. I wanted to stay in anything that was outpatient, anything that was community-based practice. That's where really my true passion lied in terms of the opportunities that had for me. And like I felt that that's where I fit well. So in my fourth year, when we had to choose rotations, I chose all of the most difficult hospital rotations I could possibly choose, because I had already decided that I wasn't going to go in the inpatient side, but I had to challenge myself and I had to learn as much as I possibly could at that time about inpatient practice before I moved on. So, having been in a community setting for 8 years now at this point, because 4 years before pharmacy school, 4 years during pharmacy school, I decided, I just need something different. I need something different, but I don't know what that is. So I, talked to a lot of my pharmacy preceptors on my rotations. I talked to some of my faculty, and I decided to do a residency. And I did my residency at the USC School of Pharmacy. And after that, I was offered a position at the Cedars-Sinai Medical Group as a clinical pharmacist. The medical director hired me there to start several programs, just, pharmacy, clinical pharmacy run patient care programs there. What I learned during my residency is, first of all, I worked a lot with an interdisciplinary team, with physicians, with nurse practitioners, with physician assistants, with people of various, healthcare clinician backgrounds. And that experience really leveraged me in terms of being able to get this job at Cedars-Sinai Medical Group. The medical group is not Cedars-Sinai Medical Center. It's a medical group affiliated with Cedars, and they're a wonderful, incredibly talented group of physicians, about 80 of them. So it's not that big. It's like about 40 internists and 40 specialists who are a part of that medical group. At the time, they only had one clinical pharmacist who was working there, which was one of my peers from USC who graduated 2 years before I did. And so she, worked at the medical group and basically did anticoagulation management for all of the patients who were referred to her for management by all the physicians. So that's I kind of had a dream of practicing in that kind of setting. So I was very fortunate and grateful to get that job. And when I did get that job, the medical director said, I hired you because you had the experience of working with all of these other clinicians, and because you had the experience of starting programs from ground up. I know how difficult that could be. So I started several programs there, and one of the things that I took from my residency training was, what I was introduced. It was like kind of this aha moment for me. I was introduced to the practice of travel medicine and travel health, which is basically the practice of basically preventing and treating diseases that are linked to people traveling to developing countries. So all kinds of preventable conditions and also non-preventable conditions, non-vaccine preventable conditions. So malaria, yellow fever, Japanese encephalitis, West Nile. What am I forgetting? All this other stuff that, basically people are at risk for when they travel to developing countries. It was all about infectious diseases and vaccinations and chemical prophylaxis, all of that. So I loved that. And I thought that the population at Cedars would really benefit from a service like that. So I started that off the ground at Cedars-Sinai Medical Group. And now it's turned into one of their biggest pharmacy-based clinical pharmacist offered programs at the medical group. So, and a lot of our grads who trained under me also got jobs as pharmacists there, just because they knew they could hit the ground running with that kind of experience. So I had a wonderful run at Cedars. It was truly one of the most, incredible years of my life, and I had a lot of great mentorship from the physicians there who really learned. Those who had really been educated in their medical education, working with pharmacists, already knew what we had to offer, and then they hit the ground running, working with us on all kinds of patient management stuff. We started like hepatitis C management for the hepatologists who were there. They said, "Thank God you guys are here. You need to manage all of my Hep C patients." So we started that program. So it was a really incredible experience. And those who hadn't worked with clinical pharmacists before came around pretty quickly once they saw how that kind of collaboration really helps improve patient outcomes and drives a lot of efficiency in the healthcare infrastructure. So after Cedars Sinai, I left Cedars not because I wanted to leave Cedars. I left Cedars because I got a call from one of my program director, my old residency program director at USC, who said, "Look, we're restructuring things over here, and we need to build out some programs that are based out of our community clinics and our community pharmacies. And we'd like you to come and help us build some of those things." And I thought to myself, one of the things I enjoyed the most about being at USC in my residency year was that kind of there's really no ceiling in academia. There's a lot that you could do. You're not really limited. This is where we build models of practice and share it with the rest of the healthcare community for them to replicate in the healthcare community, whether it's hospitals or clinics or wherever. And we research the heck out of it, and then we tell people what works and what doesn't work, and they choose to model different types of care based on that. So I thought, this is kind of my next venture, and that's what I want to do. So I went to USC not as an academician. They hired me on as a clinical pharmacist to build the programs there. And in time, my career really evolved into academia. The things that I was doing fit completely an academician's role. And let me tell you guys a little bit about that. A healthcare professional in academia does 4 things. We have to have a clinical practice, so we have to practice our expertise. We have to study all of we have to innovate, and we have to study all of that stuff, which means you do the research, you do the scholarly activity, you have to present your work. So at conferences, in journals, and you have to write about it and publish and all of those things. And you also have to provide service, which means you have to serve in state organizations, local organizations, national organizations, international organizations. You have to do that kind of committee work just basically to advance the profession. So the life of an academician is really a 24/7, 365 days a year kind of a thing where you're constantly working on stuff. And of course, the teaching component is a big part of it. I consider the teaching component a perk of my job. So that's one of the funnest parts for me, is interacting with my students and finding out what their strengths are and helping them find a pathway for themselves that works out best for them. So given that background, you guys can see where my interest lies in the world of vaccinology and communicable diseases and the prevention of communicable diseases. So I've done a lot of work in that arena. So that's my practice side. I'm currently serving as I'm an associate professor of clinical pharmacy, but I'm serving as the assistant dean of curriculum. So the entire PharmD curriculum is under my purview. And I'm responsible for not only the current content, but developing content for the future of pharmacy practice. So what pharmacy is going to be 20, 30 years from now. And also, the digital transformation of the entire PharmD professional curriculum into the virtual world. And that's been my most recent work in doing that. So based on that, let's get into our discussion about vaccines so that we can get that conversation going. First of all, I'll pause for a second to see if anyone has any questions. I'm happy to answer any of your questions during or after. So let me go through this and then bring me the good questions so we can have a really good discussion afterwards. All right, so what is vaccine confidence? So we have a spectrum when it comes to the acceptance of vaccines and the ability that they have to really prevent disease. And I just kind of want to start by saying that, you know, there's been a lot of advancement in humankind, you know, and in the public health world specifically. And, you know, a handful of those have really made a tremendous difference in the survival of mankind in this world. You know, vaccinations by far are top on that list. Refrigeration, water filtration, sanitation, these things are key to, you know, preventing diseases. If you think about, you know, the 1700s and 1800s and how disease was spreading at that time, you know, these kind of innovations were what saved the humans from dying of communicable diseases. So vaccines are really top on that list if you look at, you know, what kind of diseases we've been able to control the incidence of and the prevalence of in certain countries with vaccine usage. So vaccine confidence is really that trust that patients have, not just patients, parents of patients, if we're talking about like vaccine confidence in pediatric vaccines, but the general population has a trust in not only the vaccines, but they also have a trust in the science behind it. They have a trust in the system around it, meaning, you know, the people who administer the vaccines, the people who advocate for the use of vaccines, the people who work on policies around vaccines and recommend what vaccines be used for what populations. So that's kind of the vaccine confidence spectrum or umbrella. And then vaccine hesitancy really is just hesitancy. What happens when someone's hesitant to do something? They're not sure if they want to do it. They're thinking, maybe I should, maybe I shouldn't. That's exactly what that is. Vaccine hesitancy is basically a state of delay, or it's basically a state where people are unsure and they really just have questions and they need their questions answered. They need more information. They need to feel a little sense of comfort in their decision. So, you know, when people are informed and their concerns are addressed, that moves them further along the spectrum into vaccine confidence. So we have vaccine confidence on one end of the spectrum. And then on the other end of the spectrum is, you know, the population who refuses all vaccines for whatever reasons. And those are, you know, that population is typically referred to as the anti-vaxxers, but, you know, it's just a population who refuse all vaccines. And I want to state though, based on all of the data that we have, that group of people is very small compared to everyone else. You know, so the vaccine hesitant group is really that group that lies right in the middle of that spectrum. They're smack in the middle of that. So some people who are vaccine hesitant refuse some vaccines but accept others. They delay some vaccines and then eventually end up getting it. And they accept some and they're still considering others. So that's what vaccine hesitancy really is. So I wanted to, you know, just kind of frame that so that when we move forward into the discussion, you guys know what I'm referring to when I say, you know, people who are hesitant about vaccines. It's not that people who completely don't believe in them whatsoever. It's just people who just need a little bit more information and guidance to help them make their decision. So what does the journey of a vaccination look like typically? So the molecule has to be discovered. It has to be tested, and then it enters the clinical trials. So for those of you who are considering, any kind of regulatory science career or pharmaceutical industry career, this is, important information for you to understand what the phases of testing. So the FDA sets these rules for clinical trials, and then you always have phase 1, 2, and 3 for any kind of drug, including vaccines that you're testing. Phase 1 is, you test the product, or you test it on about 20 to 100 healthy volunteers. That passes, you've proven safety and efficacy in that population, you move over into phase 2, that's several hundred people. And then you've proven safety and efficacy there, and you move forward into phase 3, that's hundreds or thousands of volunteers. And that way, once you pass all of those phases, then the FDA will give you license in terms of, okay, it's safe and efficacious, and the benefits of this product far outweigh the risks of this product. So next, what happens is if the product is licensed, then the CDC takes a look at all of the data about the vaccine, the safety, the efficacy, adverse reactions, what kind of populations were included in the clinical trials. That's very important. You don't want to exclude anybody, okay? You want to include different types of people who fit the criteria for your inclusion population, just to make sure that you have the data that, this product would work on people that have different ethnic backgrounds, different genetic profiles, because you want to establish the credibility and the integrity of that product across different genetic backgrounds. So once that they look at all of that data and they say, okay, well, we can, based on what you've given us in the clinical data, we can now develop recommendations on how this product should be used. And that's when the CDC does that. They make recommendations and then they monitor. Now we go into phase 4, we're monitoring things. Now, why am I telling you all of this stuff? Because you probably have been, hearing about a lot of people's concern about how quickly this vaccine was put on the market, right? I mean, that's been a big concern, rightfully so. So this is just a little background for you guys, for me to address that question for you in a second. I also want to talk about how vaccine confidence changes in a vaccination program. When you have a disease within a population that is current and it's a big deal and it's everywhere, people have a sense of fear of it. So there is a sense of urgency and a very big awareness of severity of this disease in a population, okay? So what happens is when a vaccine is brought on the market to treat that disease, the uptake on that vaccine we see as an incline. People have the populations at large have a pretty good uptake on the vaccine because they recognize the severity of disease. So people start getting their vaccine. So what starts happening when people start getting vaccines? The incidence of the disease goes down. It goes down, and then after a while of being down there, people don't really think about that disease anymore because it's not as severe. Think about how pertussis, whooping cough. For decades and decades, we did an amazing job vaccinating people for pertussis, and it just wasn't around in the population. And then people stopped vaccinating. They stopped vaccinating their children. They stopped getting their boosters and things like that. And then all of a sudden, we saw a resurgence of whooping cough. In California, we had 10 infants die within a few months of a very, very vaccine preventable disease. And that was pertussis. So, once the severity of the disease kind of dwindles, people kind of tend to forget and they say, well, why do we need a vaccine if the disease isn't around anymore? And then you start seeing a decrease in the uptake of vaccines. And then you start to see the increase of the incidence of the disease. So vaccination is only stopped when a disease is eradicated. Can anyone tell me what disease we've been successful at eradicating from the face of the earth up to now? Natalie, you're not allowed to answer. Anyone have an idea? It may exist in some kind of a bioterrorism lab somewhere hidden thousands of feet under, well, hundreds maybe of feet under the earth in some lab in Siberia. I don't know. But it doesn't exist in the general population. I think I hear someone.
Polio? Would polio be one of them?
We are close.
Oh, okay.
We are close. Not exactly, not yet. Polio not yet has been eradicated, but that's a very good guess because that was one that the World Health Organization wanted to eradicate by the year 2000. But because of a drop in vaccine usage in a couple of countries in Africa, we saw a resurgence of it. But very good guess. We were close. We were so close. But smallpox was eradicated. We do not vaccinate for smallpox anymore. All right, so moving on. So how is COVID vaccine so different now than other vaccines we've been used to dealing with or talking to people about? You know, when we talk about vaccine hesitancy, you guys, I want you to understand that a lot of the data and a lot of the data comes from the research that's been done on vaccine hesitancy and vaccine confidence. Most of that research has been done in pediatric populations, in parents of children who want to get vaccines. So I need you to really know that we haven't done much research in terms of, you know, vaccine confidence in adults. That's why COVID vaccine is different, because this vaccine is primarily for adults. You know, Moderna is 18 and over, Pfizer is 16 and over. And so these are truly new vaccines. We haven't had this technology in vaccinations before. The technology is not new. I want to say these are mRNA vaccines. You guys very well know, based on your backgrounds, what mRNA is, how it works. These are mRNA-based vaccines, so it's new to the vaccination world, but it's not new to medicine and science. So they're just truly new vaccines in general. We're in a pandemic. It's a completely different situation in terms of the dynamic in patients. There's a lot of ongoing social issues that result in a lack of trust, and I'm going to address that because that's a very real problem that we have in our healthcare system in this country. And then, of course, there's concerns about fairness and equity. Are all communities going to have equal access to this vaccine? Are all communities going to have equal opportunity to get the vaccine and access to the vaccine? So there's real concerns about this. So there's a lot of those types of issues related to vaccine confidence when it comes to COVID-19 vaccines. So in order to address some of that, I want to draw your attention to the COVID-19 Vaccine Confidence Project that was done this summer by the Reagan-Udall Foundation for the FDA. Now, this is a foundation that worked with the FDA to do some research in two different types of populations to really find people's main concerns around the COVID-19 vaccine. Okay, so as the vaccine was being developed, they needed to understand what concerns people had in the communities so that they can help address those concerns, answer people's questions, and really figure out how they had to talk about the COVID-19 vaccine. So what they did was they went to a population of healthcare providers, and they went to a population of typically underserved communities. So they had Native American Indian, African American, and Latino populations, certain communities that they invited to get their input on what their concerns were about the COVID-19 vaccines. And so they developed, they found three main things. So they had all of these listening sessions with all of these different people who participated in these listening sessions. They basically just sat there and listened. They threw out questions to the volunteers, and they just listened to their very, very real concerns. And they came down with three primary themes around people's concerns. One was vaccine development. A lot of people were concerned about the speed in which this vaccine was developed and put on the market. And basically thinking, okay, well, if it was done that fast, how could this quick process not affect the quality of the vaccine? So in people's minds, it was just very counterintuitive. And they were fearful that the vaccine would not work for me, my family, or my community, because, you know, what I said earlier about making sure that when we do clinical trials, we have to include people from all kinds of ethnic backgrounds, genetic backgrounds, men, women, everyone, so that we are sure that this product works equally across all of these populations. So they were afraid that people who look like me it may not work for me because you may not have included people who look like me, which, you know, is very fair concern. The next one was vaccine review and approval. Please remember what kind of an economic and political climate we were in at the time. People had a lot of distrust in government. They figured that there was going to be a huge lack of transparency. The FDA wasn't going to, you know, share a lot of information. And then people had some real concerns that economics and politics are going to be prioritized over the science, over people's general welfare, over people's health. That's what they were concerned about. Historical and current structural defects. And if you guys don't already know, which I doubt, I think you probably already know, but there's a lot of concern about disparities in our healthcare system, which are very real existing disparities in our healthcare system. Okay, so not all communities have equal access to healthcare. They don't have equal access to opportunities to receive healthcare. So there was a lot of that historical precedent that was really on people's mind, that was affecting their decision on whether or not they would have a good experience with a vaccine. So given all of that, they started to address all of these issues. Now, what I can tell you is that the FDA's process and all of the drug development for anything, not just COVID vaccine, is completely available. It's all public information, FYI. It's all public information once a drug is released. And it doesn't mean that people are going to go access it. You know, everything could be found on the FDA website. It doesn't always mean people are going to rush to go find it and read all that information, but it does exist. It is out there for people who really are interested in learning about, you know, what the process was. Now, I want to talk about this because this is a very big question on most people's minds. And as, you know, pre-health majors, you guys really need to know this so that you could share this with your community. And I really encourage you to do so. This is available. This is public information. This is on the Reagan-Udall Foundation's website. This is the PDF. It's in a PDF form. You can easily get it. But I figured it's best to use this illustration here so you guys can really see why the vaccine was able to get on the market so quickly. This is the vaccine development process in its normal phase, okay? You have a molecule that's developed, there's research in labs, there's preclinical trials, all of that is done. Of course, people need money to even start this. You need scientists to start this. And then once you have something, then you apply for the clinical trial. You start your phase 1. You collect your 20 to 100 volunteers in phase 1. You finish that, and then you wait because you need more money. You're waiting for funding, you're applying for more funding, you're analyzing your data in phase 1, and you need more money to get into phase 2. Finally, you get the money, you get into phase 2 with your, you know, hundreds of volunteers, and you run that. And then when you end that, again, you have to spend time analyzing your data, you need more money, so you go out there, spend a few months trying to get more money. So this just keeps going. And then you're done with that. And then the FDA has to spend time reviewing. So there are, you know, however many people who are on the FDA review panel who spend a lot of time reviewing the clinical data, safety, efficacy, all of the data that's been produced by the researchers here. So once they've done that and they've approved it, then they go into manufacturing phase and then they go into distribution phase. So as you guys can see, this from this point where the molecule is developed all the way to the end can be up years. It depends on the drug. It could take decades, you know. But if it's not a novel molecule, it takes less than decades, but it could still take a couple of years. So what happened that got that COVID vaccine on the market so quickly? Well, guys, we were in a pandemic. Millions and millions of people died from a very severe and communicable disease. We've been through hell and back this last year, right? The whole world has. So this is a very, very different situation than normal circumstances. So what we saw was quite phenomenal. You'll never, ever typically see drug companies coming together, sharing their science, sharing their data, sharing their people, their best people, their top scientists, their top developers, their top reviewers. You'll never see that under normal circumstances. But I'm just happy to see that there was the moral compass was pointing in the right direction, and people came together for the right reasons, for the well-being of humanity, and did this work together. So once again, that mRNA technology was not new. It existed. It had been tested in other ways before. It had been tested in other drugs before. We knew it worked. So that was used. So basically that's this step one right here, is the research and preclinical trials didn't need much time. The virus was isolated early on. All it takes is a very simple PCR to replicate that, right? So that was quick. And then what happens in a normal drug when you're recruiting volunteers? I mean, if your drug is to treat congestive heart failure, you can only recruit people who have congestive heart failure. You have a very limited population, right? But in this case, the world was your population. The world was your volunteers. So they had no problem getting volunteers to sign up to go through these processes. So what's happening here? Phase 1, 2, and 3 are still occurring, but there was money coming in from everywhere. Funding was never an issue. Governments were funding. Private entities were funding. Dolly Parton funded Moderna $1 million, right, to get things started. There was no problem with funding. This process never came to a halt because people didn't have enough money to continue. It never came to a halt because they didn't have enough volunteers who wanted to get into phase 1, 2, and 3. Okay. Everyone was, yes, I'll do it. Yes, I'll do it. Give me the vaccine. So the speed at which they were able to sign people up and move the process along was very different than normal circumstances. So what's also happening here is that concurrently, you're seeing the manufacturing happening. So manufacturing is happening at the same time as your phase 1, 2, and 3 are going on. So instead of in a normal circumstance when you have each phase subsequent to the next, here you're seeing a lot of things done concurrently because it was reasonable to do so. Okay. So then you have the review panel. Now you've gone through phases 1 through 3, and then you have your FDA review. Now, in a typical circumstance, let's say arbitrary number. If the FDA is going to put 100 people on this job to review, they put 300 people on the job to review it. So everyone literally dropped everything that they were doing and made this their highest priority. That's what happened. Nobody looked at anything else except COVID vaccine data for 2 months. They did all of that, together, collaboratively. And once all of the safety and efficacy data were proven and FDA gave the use authorization, then it went into distribution. So I hope that this this illustration here helps you guys understand a little bit better about why the vaccine was able to get on the market. No steps were skipped, nothing was rushed unnecessarily, and there was zero government involvement or influence in the entire process. This was all science. This was all scientists, all developers, everybody working for the FDA and the drug companies whose job this really is, to do this and get this out to the global population. So I hope that helps clarify the process a little bit for you guys and helps, maybe bring some relief in knowing that, the legitimacy of the process, the integrity, number one thing, the integrity of the process was maintained and protected the entire time. So in terms of, side effects, I want to show you guys the data of the incidence of side effects reported during clinical trials. This is the one on average across all vaccines out there, pain, fatigue, headache, myalgias, which are muscle aches, chills, fever, swelling, joint pain, nausea. These are the percentage across all vaccines. And here is the breakdown of the Pfizer versus Moderna. As you can see, they're pretty much in line with each other. And yeah, we are seeing, this is just clinical observation based on what I've been seeing for the last 4 months now, is with the second dose, people tend to have some more pronounced adverse effects, but they're very short-lived. They typically last 1 day and then the next day you're fine. I got the Pfizer vaccine. I basically had arm pain, muscle pain on my left arm, and my left side, a little bit on my neck after the first dose, but it was gone the next day. And then after my second dose, I felt nothing the day of. I had a mild headache the next day, and I was on site at Dodger Stadium the third day on our opening day for vaccines from 6 in the morning till 9 o'clock at night, and I was totally fine. So that was my experience with it. Moderna, same thing. Is, some people experience side effects with the first one and not the second one, and some people experience side effects with the second one and not the first one, or some people don't experience anything at all. So it's really kind of all over the map, but we know what those effects are. They're anticipated, they're expected. So when we give the vaccine to people, we counsel them on what they are to expect, so that if they experience any of these things, that they're not surprised, that they're, there's some peace of mind saying, okay, Dr. Mirzaian said that I would probably experience something like this. So I know I'm not shocked. I'm not thinking that I need to go to an ER. Okay. So another thing that was found from the Reagan-Udall Foundation's COVID-19 project was that, they asked, who do you trust most when it comes to vaccines, when it comes to medications, and when it comes to specifically the COVID-19 vaccine? Where does most of your trust lie in terms of who would you go to really help you make the decision on whether or not you should get the vaccine or if it's right for you? And the 83% of the responses were my doctor, my nurse, my pharmacist. And it wasn't, guys, I want to point out, it wasn't a doctor, a nurse, a pharmacist. It was my doctor, my nurse, my pharmacist, which tells you that when you have a relationship with your patients, they put all of their trust in you for something like this, and you cannot violate that. That's sacred. So you have to be honest, you have to be open, and you have to communicate clearly about what we know and what we don't know when they come to talk to you about it, so you can help them make their decision. I was really happy to see that the president, Congress, and celebrities were kind of on the bottom of this, and only because this is not something that, the president is not a scientist or not a physician, not a pharmacist, not a nurse. The, celebrities are not these, that's not their expertise. They can endorse something, but when it comes to making a personal decision, people don't go to, those guys. People go to the health professionals that they know and they trust, which is really good news, which basically puts a lot of responsibility on all of you, because you're going to go into these health professions, and you need to really hold sacred that fact that your relationship with your patients makes a difference. And you always have to maintain the integrity of that. So I'd like to also include this for all of you. Since you're all pre-health, you're all going to go into some kind of a healthcare profession. We are all in a healthcare profession for one thing: to treat patients, to help resolve medical problems, medication-related problems, to improve health outcomes in people, to advocate for patients, to advocate for people who can't advocate for themselves when it comes to their health, right? These are some of the reasons why we go into these health professions. So your words matter. They matter a lot. They make the difference, very much so, trust me. So if you choose your words carefully, they will make all the difference in how your patients respond and what they do. So if you're telling your patient that you have type 2 diabetes, you need to eat better and you need to take all of your medications, there's a way that you have to tell them that. There's a way you have to communicate that to them to help empower them to manage things like that on their own. So when it comes to COVID-19 vaccines, the best strategy, or just vaccine confidence in general, the first thing that you have to do is listen. That's the most important thing, honestly. And you'll learn this in your careers. When your patient comes to you and they have a concern, they're saying, no, I don't want to do that. Your response should never be, yes, you should, because. No, that's not what you do. You say, tell me why. Tell me what you're concerned about. What is bothering you about this? You have to listen to what their concerns are so you can specifically address that concern. I was on a webinar, and then there was a pediatrician who was saying that, when I first started, there was a patient who, a parent who said that, I'm concerned. I walked in and I said, okay, well, we have to do this vaccine. The parent said, I have a question about the vaccine. And the physician, the pediatrician, just kind of went off onto this monologue. He's saying it himself. He said, I just went off on this monologue because I assumed what her question was going to be. And he said, I thought she was going to ask me about autism and this and that. And I went on about and lectured her for like 10 minutes on why she's wrong and this and that. And then he said, I lost her. He said, I lost her attention. I wasn't there anymore. And he said, it's because that was not even her question. That was not even her concern. She had a completely different question for me, but I didn't listen to what the issue was. So I could address just that. But now what have I done when I've lectured her about all these other myths and things? Now I've introduced her to all of these new funky concepts that are untrue. And now she's on a completely different thought process now. What did I do? So that's what he was saying. And we all learn somehow when you get into your health profession, you start working with patients, you figure this out. You're like, oh, wait a minute, I just totally made an assumption that I shouldn't have. So you listen first, you figure out what their issues are, what their concerns are, and you tailor your response to that. You tailor your response to address exactly what their concern is. Now, when you do that, you have to be accurate in what you're saying. You have to communicate clearly. You cannot use fancy terminology, no medical terminology. You have to use just very simple terminology in simple terms to clearly convey a message to your patient. And credibility is important. What do I mean by that? What I mean by that is there's a lot that we don't know, right? You guys are all scientists. There's a lot of humility in science. We have to be humble in science because in science, we're all constantly discovering things, testing things, and then either being proven right or being proven wrong, right? So we have to be humble about sometimes things don't work. Sometimes we don't know the answers. and we're working on figuring them out. So being credible and saying we don't know yet, the data is being looked at, it's being monitored, we don't know yet exactly how effective this current COVID-19 vaccine is against the variants. We don't know, but there's a lot of monitoring happening right now to determine that, and I think we're going to find out soon. So basically admitting when you don't know something, when we don't have the facts or the knowledge, is really important in establishing your credibility as a clinician. Displaying respect and empathy. If someone's had a bad experience with a vaccine, don't brush it off. You show empathy, because that way your patient connects to you and they feel like they're heard. If someone feels that they're heard, then they're more likely to open up to you, and they're more likely to take in what you have to say to them. Avoid repeating false claims. If someone doesn't it doesn't bring up, I don't know, lots of vaccines exist out there and people are making it in their garages. If they don't bring that up, don't bring it up. Don't say, don't worry, no one's making it in their garage. And then your patient says, what? Is that happening? So you guys are laughing because you know it's real, right? People do that. And of course, be nimble with your messaging. We are constantly getting new information. So you have to stay up to date, stay current, and be flexible with how you are conveying your message as we go. Well, not lastly, I have one more slide after this, but this was I just want to tell you guys how incredible this experience has been, how emotional, how overwhelming, how impactful this whole experience has been. Do you know how many people have cried as they held my hand after I gave them a vaccine? Cried and just like squeezed my arm and saying, I wish I can give you a hug right now, but you have no idea what kind of relief this brings me. So it's that gratitude is worth everything. Yesterday at Dodgers, we did 9,800 doses. Last Saturday, they did a little over 12,000. People wait in the lines for a long time, and they're patient, and they don't care if it takes 40 minutes, and they don't care if it takes 3 hours, because they say, you know what, I don't care. I say, thank you for your patience. I know it's been pretty crowded this last couple hours. And they say, we don't care. Thank you for doing this. Thank you for being out here. It's that level of gratitude that makes it all worthwhile. This picture in the middle is especially special to me because that's the LA Fire Chief, that's our Dean, that's the Mayor, that's one of my colleagues, Dr. Carla Blyden, that's my colleague, Dr. Richard Dang, who was my student, my past resident. I hired him when he finished his residency, and he's just been the star. He's been on the cover of LA Times multiple times. So it's been really rewarding to see that. And that's Sean Penn. You guys know Sean Penn? That's kind of special because I grew up watching Sean Penn in his youth in movies. He is the guy who started CORE, Community Organized Relief Effort. So his organization, basically, he gathers thousands of volunteers to go help out in community relief efforts all over the world. So it was really cool that the city, USC, and CORE came together to really get these vaccine sites up and running early on in January. So here's the status, guys. As of this morning in California, we have administered 9.5 million doses. 12 have been delivered, almost 13 million have been shipped. So we're doing really well. Look at LA numbers. We're at almost 2.3 million doses in LA. So that's thanks to the efforts of everybody out there who is administering vaccines and giving up their time and their weekends and their nights and all of their time volunteering to do this. So kudos to everyone who's been involved in any way, shape, or form. The volunteers who check people in, the volunteers who walk around with the iPads, getting people's names and dates of birth and everything. And the LA Fire Department has been incredible to work with. So it's just, we have a lot of thanks to give to a lot of people in our community for helping with this effort. So with that, I'm going to end the presentation. I didn't really leave much time for questions, did I? I'm sorry.
That was fantastic. Thank you so much. Yeah, now we're open for questions. If you guys are a little hesitant at asking, you guys can throw it in the chat. You guys can raise your hand, whatever you guys are comfortable with.
Dr. Mirzaian, I had a quick question actually.
Yeah, go ahead.
And you might have addressed it, maybe I just didn't catch on to it, but why exactly is like, in terms of the vaccine, is it not like available for, let's say, like children yet? Does it have to just do with like not knowing the risks, or what exactly?
Very good question, Nicolette. The reason for that is because anytime you have an age indication on a drug or a vaccine, it's because it's been tested and proved for safety and efficacy in that population. So generally, we do not test new drugs on children or pregnant women unless the drug is to treat some kind of a pediatric condition, and then and only then can it be tested on pediatric patients who have that condition that needs to be treated. So in terms of the vaccine, all of the vaccines have kind of followed along the same process where it comes out on the market, it's tested in the adult population, and then the safety and efficacy is proven there. And then they start like testing a little bit on younger populations until the safety and efficacy is proven there as well. But that's easier to do once it's been working in the adult population. So with the flu vaccine, we saw the same kind of process where it was tested on 18 and over, and then we slowly saw the age indication decrease, and now it's at 6 months. All the flu vaccines are 6 months and older, except with the exception of a few of them that are particularly of different action. I hope that answers your question. Sure. And
yeah,
thank you. Okay, good. In the future, we're probably going to see that age indication drop down, I'm sure.
Thank you so much.
You're welcome.
I have a question actually.
Mm-hmm.
So I noticed you mentioned in the statistics that a number of pregnant women actually got the vaccine as well, and whether they experienced any side effects. What would you say to people who are planning to get pregnant, or those who are looking forward to having children in the future? How might getting the vaccine right now affect or maybe cause any risks in terms of that? Or is there not enough data to support any?
So good question, Eric. So pregnant women aren't generally included in clinical trials, but I'll tell you what ends up happening is women enroll in the trial and they're asked if they're pregnant or if there's a chance that they can be, and they say no. But then what happens is they get the vaccine, and then later on they find out that they were pregnant at the time that they got the vaccine. So that is reported. That's reported to the FDA, to the researchers, to the CDC. So that's how we monitor data of how vaccines affect women in pregnancy. So the pregnancy is discovered after the fact. And that's why that's how pregnant women are included in this data, is because they reported their pregnancy after they got the vaccine, or they discovered they were pregnant after they got the vaccine. They didn't know that they were pregnant at the time. We still do the same with other vaccines. There are live attenuated vaccines that we don't give to pregnant women, but they say, no, I'm not pregnant, and there's no chance I can be. We give it to them. And then 3 weeks later, they call us and they say, I was wrong. I was pregnant when I got this vaccine. So then we go through the reporting process. So to date, we haven't had any documented issues of concern with fetuses being affected by the vaccine, by any of our vaccines, by the way, not just COVID. It doesn't mean that we still haphazardly give it to pregnant women. It just means that we haven't seen any issues of, with the fetus with the vaccine. So same reason why we have pregnancy data currently with the COVID-19 vaccine. So what would I say to women who are pregnant or who are considering becoming pregnant? I would give them the facts. I would share the facts with them. I would encourage them to talk to their providers as well. I will give them the information that I have, and I will encourage them to also talk to their providers. And there's something called shared clinical decision making, which means that I would include their OBGYN and the patient in a conversation together, so we could all like address the facts, and then we can help the patient make an informed decision. So currently the data shows that the COVID-19 vaccine doesn't affect any development of the fetus and no issues after birth as well. We also know that there are 0 issues that have been discovered with the possibility of getting pregnant. So, these things start from very simple, people just having simple questions like, does it affect fertility? And one question becomes a statement in the population. It's kind of like when rumors start, kind of the same process. There has been absolutely no data to show that the COVID-19 vaccine has affected fertility at all. In fact, based on all of the information that we have, all of the data that we've seen, the CDC recommends COVID-19 vaccination in pregnancy, and reproductive endocrinologists and gynecologists all over are recommending COVID-19 for women even considering to become pregnant. So why do we do that? Because we know the safety of the vaccine. We know that it does not contain a live virus. We know that it's an mRNA that's very short-lived and also just doesn't stick around in the body very much. It's degraded and disintegrated, and then the antibodies are what stick around. That's what we want. So in fact, we want the antibodies in pregnant women. We want pregnant women to pass those antibodies along to the fetus. Same reason why the flu vaccine is indicated for pregnant women, because we want, first of all, we want to protect pregnant women from the flu, and we want to protect them from COVID. Same idea, right? Because we don't want them to be in pregnancy and then get a severe disease and, God forbid, die. Okay, then you've lost 2 lives and not 1. So the risk of COVID infection is far higher than any risk that the COVID vaccine can give you. Same thing in terms of, people have questions about I don't know what the long-term complications are of the vaccine. Well, the vaccine is an mRNA vaccine. It never enters the nucleus of your cell. It's a messenger, correct? Messenger RNA. Messenger RNA signals your cells, signals your immune system to say, look at this particle, it belongs to this virus, and then your immune system kicks it up into high gear and starts producing antibodies, right? So it's the production of antibodies that makes people feel the side effects that they feel. It's your body responding to what it thinks is a virus, right? Thank you, Lauren. Thank you for saying. So it's responding to what your body thinks is a virus, and that's why people feel the side effects that they feel. It doesn't mean that they have the virus. It doesn't mean that they got the disease. It just means that's your body's natural response to a foreign antigen. Okay, it's trying to get rid of it, but it's not. It's only an antibody. It's just mRNA. It's not an actual virus or a viral particle. So the CDC, again, just to kind of go back, the CDC is recommending that pregnant women and women considering pregnancy get the vaccine, because we know that long-term complications of COVID are far worse. And we're discovering a lot more now from people who had COVID infection, whether they were asymptomatic or symptomatic. We're starting to see some major long-term complications that we don't know when will resolve. Different kind of long-term respiratory complications, long-term cardiac complications, long-term gastrointestinal, long-term brain complications. So we're seeing all kinds of things that are related to the actual infection itself and not the vaccine. So that gives us a lot of, kind of relief to know that getting the vaccine is a lot safer than actually getting the infection.
I have a quick question. In terms of waiting to get vaccinated, I know that the CDC released a statement saying 90 days, if I'm correct. But then the other day I was talking to someone and they said 180 days. So what are your recommendations on that, and why do they give that recommendation?
Okay, so the CDC's current recommendation is 90 days. They're saying that if you had a current infection, then your body has naturally created antibodies towards the virus already. So you still have a level of protection from reinfection because you have the antibodies. Now, what we've learned over the past year is that COVID antibodies, that IgG, that gamma globulin, that doesn't last very long in our bodies. It's different with something like varicella or measles, like lifelong IgG. But when it comes to COVID with natural infection, those antibodies are lasting about 3, maybe 5 months, but rarely is it 5 months. Mostly we see 3 months. So we know that with natural infection, 90 days, you have antibodies. Because our vaccine is in such short supply right now, and we want to make sure that everybody can get it, that's why the CDC is recommending that if you had the infection recently, wait 90 days because you still have some protection. So wait till we get the other populations through, and then it'll be your turn for getting the vaccine, and then you can get it then. So that's really why they're saying it. 180 days is an estimated, like the other end of the range of time that your antibodies can last, but we're not seeing that with many people. We're not seeing the antibodies last much longer than 90 days. But those are the reasons why, because we want to make sure we have ample supply for everyone who needs it now. And if you have antibodies floating around that are protecting you, leave it, let it do its thing, and then that buys you a little bit of time to get the vaccine later.
Dr. Mirzaian, can I ask you a quick question?
Yeah.
So I know a lot of people have anxiety about getting the vaccine, but today at work, I actually experienced someone who had anxiety after getting the vaccine. She was sort of oversensitized to like her body and what her body was feeling after getting it. How would you respond to someone like that?
So this was directly after you gave her the shot, or like days?
So this particular patient came into the pharmacy. I didn't give her the shot directly, but it had been a month since she got the shot, and she said that she's had a headache every day for the past day since getting the shot. And she feels like she's been super anxious too.
Yeah. So that's a little bit of a different situation. I would first sit her down, and I would just kind of do a little icebreaker stuff to take the edge off a little bit, to get her to, take a deep breath. And I would tell her, I want to talk to you about this. I'm going to spend some time with you. Don't worry about what else is going on around you. Like I would just make her feel safe first, that, I'm going to dedicate my time to her, and I'm all ears, and I want to listen. And when you do that, that tends to calm people down. And then just have her tell you exactly what she's experienced. This pandemic has brought on levels of anxiety in people that are far beyond normal in any age group, especially in children, especially in older adults, because they've been so isolated and so alone. It's really worked a number on people. It's really, really sad. But what I would do in that case is just have her tell me what she's feeling, have her tell me how long it's been going on, have her, tell me, why do you think that is? What else is going on? Are family visiting you? Are you, living by yourself? What do you do every day? Do you go outside? Like, I would just ask those types of questions to just get a general feel for if it might be something else. I would refer her to talk to her physician too. You know, if she really feels like it's a serious anxiety issue, then I would 100% refer her to her physician to say, you know, let's talk to your physician and see what's going on. If you feel like your heart's beating too fast or something, let's get it checked out. So that could be done. I would tell her that, you know, levels of anxiety are through the roof right now, and that it could be everything just kind of like culminating at this time. But I would reassure her that, you know what, the adverse effects from the vaccines haven't been lasting, don't last that long. But if you are having a headache, or if you are experiencing these things, then, you know, let's talk to your physician about it. It could be something else. It could be something else that's causing it. Do you know how many people, because of anxiety, are just like clenching, they're grinding their teeth at night, and they have headaches because of that and don't realize that they're doing that? You know, they're just anxious in general, and they're like really, really tight, and their neck muscles are tight, and that causes a lot of headaches. People are on Zoom all the time. Maybe they're straining their eyes and causing a lot of headaches. There's a lot of reasons why that could be happening.
I provided her with a lot of resources, thankfully. But
Yeah,
it was
good.
interesting because she was saying everyone was like, in her family, she was also Armenian, and everyone in her family was like, oh my God, why did you get the vaccine? Like, you don't know what's happening. And it was very interesting to see that dynamic and that cultural sort of stereotype translate between your patients and, you know, this generation of people. So
That kind of tells me all I need to know now, because this poor person was just reacting to all of the stress factors that her family was putting on her.
right.
You know, now she's like, it's almost kind of like a brainwashing type thing. With maybe it's not the right word, but if someone tells you something enough, you start to believe it, or you start to become skeptical, you know, and really start to second guess if you made the right decision. Yeah, that's unfortunate. But I would definitely recommend that, you know, tell her that these are things that are caused by multiple things, and the vaccine side effects don't last that long. They're a day and then it's done. Yeah.
Thank you.
And I think a lot of credibility comes into play as well. You know, I mean, if your family or that patient's family, I mean, they're not healthcare professionals, I'm assuming. So you can only lightly take their word for, you know, seriously. So
Yeah. But then, you know, like Natalie mentioned, it's a cultural thing sometimes too. You know, I've done a lot in my career, but, you know, if my mother-in-law asks me a question about her health condition and I give her a response on what she should do to take care of it, my word doesn't matter as much as her best friend of 60 years. You know what I mean? It's a reality. It's not a blow on her. It's just like it's just a cultural thing that people trust their peer groups, by the way. That's what it is. People trust their peer groups. So, you know, that's why it's very important for those of you who are pursuing, you know, these health professions, that you realize the power, the influence, not power, that's the wrong word, the influence that you have over people's knowledge, outlook, perspective, attitudes towards things. That's something I do a lot of. I do a lot of research in the social behavioral model, KABP, knowledge, attitudes, beliefs, and practices when it comes to, you know, making decisions about healthcare issues. And attitudes are a big factor, and they could be, you know, either it's all how people's attitudes that they've grown up with, or their current attitudes based on an experience towards something. So that the peer groups are a big influence there. So you have to recognize that so you can address it the right way.
yeah. Does anybody have any further questions for Dr. Mirzaian?
Can I ask one last quick question? It's just in relation to what we're talking about. I know it's getting kind of late. If you have had a patient that's super like persistent on refusing to get like a vaccine, whether it be like COVID or flu vaccine. How have you like gone about such a situation? Like,
So that is a good question, and we're kind of talking about now this hesitancy model and how which end of the spectrum, that timeline that I showed you guys, which end of the spectrum is this person on, and how close are they to the complete refusal of it? I've definitely dealt with that. But please understand that when I say that most people are in that hesitancy place, that's really where they are. So I had a friend of mine who's a very, very educated person call me and say, you got to talk to my mom. I said, why? What's going on? Like, my mom won't get the vaccine. My dad did. And we all did. She will not get it. I'm like, okay, have you talked to her about it? She said, yeah, but she's so frustrating. She just frustrates me. I'm like, well, don't talk to her like that. I said, okay, I'm gonna talk to her. It's rough when it's your own parents because you have a different like emotional barrier there. So, you react. And so she was yelling at her mom of why she's wrong and why she needs to get it and this and that. I said, you're not really addressing what her concerns are. So I called her mom and I said, I heard you have some questions. What's going on? And she said, yeah, I have questions. I'm not sure if I want to get it because of this reason. She goes, we don't know anything about this vaccine. We don't know how is it, it came on so fast and we don't know what's going to happen to us after we get it. And I said, you're concerned about all the right things. I said, you know what? I was even really concerned about that. So 1, it's listening. 2, it's validating. People need to feel validated, like their concerns are real. They don't want someone telling them that their concerns are unreal or unnecessary because it's like brushing them off. Because if they have questions, they need to have their questions answered. So I said, and this is a very typical process, by the way. So I know I'm giving you a particular example, but this is a very like general process and what you go through when you encounter someone who doesn't want to take the vaccine or is unsure about it. So you say, okay, well, what are you worried about? Tell me the main thing that you're concerned about. And then she said, well, I'm concerned about 2 things. 1, I'm concerned why it came on the market so fast and I don't even know if it's going to be safe. And 2, we don't know what the long-term complications are of this vaccine. And I said, okay, well, yeah, you're right. It did come on the market so fast. And you're right to be concerned about that. I said, who isn't? I was too. I said, but I now know, like, I know why it came on the market so fast. I said, I told her, you have to understand it was everybody dropped what they were doing to get this done. There was all the money in the world that funded these processes. And also, they didn't have to wait for anything. They had thousands of volunteers from all over the world to do these trials. I said, if it wasn't safe and if it didn't work, it would never have gotten to the market, never. Because everyone who was doing this were the scientists, they were the drug developers, they were these people who do this for a living. I said, so I've seen all of the information, I've seen the timeline, I saw what kind of work they did, and I trust the process fully. So I said, that's what made me feel safe about it. I said, that's what eased my mind, and I happily went and got the vaccine because I learned about how it was made. And then her other thing was long-term complications. I said, you know what, you're right. It's new. It hasn't been on the market that long, but we're continuing to monitor all of the data. And so far, we're not seeing anything in terms of long-term. It's been a year. We're not seeing anything in terms of long-term consequences of the vaccine. I said, but you know what? I said, we're seeing a lot of long-term complications with the actual infection. I said, people now have permanent heart problems because of it. Now people have permanent breathing problems because of it. Now people have permanent damage to tissues in their brain because of their infection. I said, if you ask me, any long-term complication of the vaccine is far better than any long-term complication of the actual infection. So I said, for me, the decision was easy because I knew with the vaccine that long-term complication was going to be nothing. And if anything, it was going to be tiny versus what I could have experienced with the infection. So I said, that's what makes me feel better about it. So I hope that helped, Nicolette. It's just, you know, it's very individualized. You really have to just kind of tailor it to what that particular person is concerned about. But remember, those processes are similar across the board. You listen, you validate, you show empathy, and you present the facts, and then you share your own personal experience, which helps like put their mind at ease.
Thank you. That was really helpful. Giving me perspective too. Thank you.
You're welcome.
Dr. Mirzaian, before we conclude today, can you provide a little bit of advice for those of us who are, you know, on the path to pharmacy or looking forward possibly to USC?
Yeah, sure. I'll tell you, I've chaired that admissions committee multiple times, and I've been serving on that admissions committee for many years. I've been at USC now for 17 years, so pretty familiar with the process and what we look for in students. You know, we're always recruiting top of the line. We're always recruiting top of the line, but what does that look like? I need you guys to think about what that looks like. Top of the line doesn't always mean 4.0. We're looking for really good candidates who could be leaders and are interested in different areas of pharmacy. We fortunately I'm grateful to be at a university where our School of Pharmacy has different departments, and we're very, very tight and very close, and we have a lot of alumni who are very tightly integrated into our school and very invested in our students. Regulatory sciences, if you ever want to go into the drug or food regulation and drug development arena, health economics and policy for, you know, if people want to do pharmacoeconomics, a tremendous drug development, pharmaceutical sciences department. I mean, they've developed drugs for these guys, the molecules that they've developed in here, and they're my everyday colleagues. It's pretty incredible that I get to work with them on a daily basis. And then our clinical pharmacists are super leaders in state and national organizations, really pushing the pharmacy profession forward. So we're looking for students who have a variety of interests. We don't want every student to look the same. We want people with different backgrounds. We want people with different experiences in life. I tell students all the time who are thinking of applying, I tell them, you know what? We don't expect everybody interested in pharmacy to have a pharmacy job. You can't have a pharmacy job when you're not a licensed professional. It's hard. You can't do that. And if you volunteer in a pharmacy one time, that does not give you a real impression of what your opportunities are in the profession. It's one of the most versatile degrees I've ever come to know. I tell people that, you know, you have to work hard. You manage your time well, do well in school, because you want to come into a PharmD program with a very strong foundation, science foundation, so that you can like hit the ground running and propel forward and not spend a lot of time just catching up on the science. I tell them, you know, share your life experiences with us. We're looking for people who come from interesting backgrounds. Tell me about what jobs you've held. If you've worked at McDonald's, tell me that. That's a good thing. I want to see that. You know, some people shy away from putting their Macy's job or their, you know, I worked at Skechers shoe store. They don't put those things on their applications, but I think it's very important to do that, because that shows that you've done other things with your time, and as well as going to school, and that you have, you know, been in a situation where you've been in a retail environment or a corporate environment. You've undergone training. You've had a boss. You've had to report to work at a certain time. You might have had people yell at you. and not be very nice to you? And how did you learn to handle that situation? You know, if you were confronted with a difficult situation, how did you handle that? These are all things that I encourage people to think about when they're applying, because it comes up. Life experience says a lot. Your education is very important. Your life experiences, work experiences, what you have done with your time is very important as well. It really shapes who you are and what kind of skills you come in with and what strengths you have, and where that can basically, what kind of paths can open for you based on your interests and your experiences and all that. So very simple advice: make sure your application is complete. Don't turn in incomplete applications. That does not look good ever. Make sure that the letters of recommendation that you're getting are from people that you really do have people who have a really good idea of who you are and what your strengths are, who can really speak to who you are. And if they are advocating for you, we want to know why. And it's easy to tell when applicants ask for letters from people who don't really know them very well. It kind of just comes through. Never falsify anything. Don't say that you've worked somewhere when you haven't worked somewhere, because it always comes out, and that's never good. What else?
Be genuine.
Be genuine. Integrity is a big deal in the healthcare profession. I don't need to tell you guys that, but it's very, very important. It across every single point in your entire career, from undergrad all the way through the end of your career. It's very important. You just expect that in any doctorate program you get into, you're going to have to work hard, and you're going to have to put a lot of work into discovery. I tell people, you can come in with something in mind that you want to do, and I promise you that in 4 years, that's going to change. Because you might come in knowing what you want to do with pharmacy, but you don't know at that point in your life how many different things that you could possibly do. You don't always know what your options are until you get here, and you're here for 4 years and you discover so much and you meet so many people with cool career pathways, and then you get inspired, and now 4 years later you want to do something totally different. So I tell them, don't be afraid of that. Don't be afraid of exploring. Yeah.
I guess that's the beauty of USC, you know, because there's so many different pathways you can take in pharmacy, and most people think it's you know, just filling and dispensing at the community sector, where it's also, you know, biotechnical companies and such. So yeah.
But you know, I have to say, you know, I started there, and it's a very important part of pharmacy practice. It really is, because you really get the most face time with patients in a community-based setting of some type. That's where you get, and that's where people have most access to healthcare and healthcare advice is community-based pharmacies. But no two are the same, right? And it's really about what you want to do in that setting. But these are the basics of drug knowledge and medication regimens and things like that. If you don't really understand the basics of pharmacy and medication use at the patient's level, then you won't understand how to do your job well if you're in a managed care organization, or if you are in a clinic, or if you are on the industry side or on the policy side. You won't be able to do your job well unless you really have on the ground knowledge of what the problems are when the drug gets to the patient's hands. So it's all important, all of it.
Yeah, so absolutely. Even especially in the community sector, where you have to explain something complex in the most informal way, so they understand it. Yeah.
But you learn how to do that in pharmacy school.
Yeah, I'm looking forward to it.
Good.
So thank you so much for coming and giving this excellent presentation. I think we gained a lot of insight. Please come back soon and share more with us. If there's no other questions, I'm going to bring this meeting to an end. So,
may I just say thank you guys so much, and thank you for all the amazing questions. I really loved answering all of your questions. So very happy to meet all of you guys.
Yeah, likewise. I mean, as somebody that's not really not too interested in going into pharmacy, like I learned so much throughout this whole session, and I think it was such great information, and you did such a great job just making everything clear for all of us. Thank you so much.
You're very welcome. You're very welcome. Thank you guys for having me.
Thank you.
Thank you.
You're welcome.
thanks.
Okay, good night.
Take care.
Good
Have a
night.
good evening.
You too.
All right.